This research study aligned with the Canadian Health Institutes of Health Research Strategy, or patient-oriented research, where patients, their caregivers, and members of the public were directly involved as members of the research team. A website, mystrokerecoveryjourney.ca, was co-designed by patient partners and researchers and was implemented into the research study. My Stroke Recovery Journey is a website inspired by the journeys of others, initiated by people who have lived through a stroke, and created by a team of stroke survivors, caregivers, healthcare providers, and researchers, all working in partnership.
We recruited 5 older adult research partners with the lived experience of having a stroke who were living within the 2 study regions, Hamilton and Niagara. 2 of the patient partners were involved in developing the paper-based version of the My Stroke Recovery Journey map.
It's important to engage people with lived experience of stroke. Through meaningful partnership built on trust and mutual respect, the team created an online interactive resource to support hospital to community transitions for those who have had a stroke. Our vision for My Stroke Recovery Journey website.
The jargon of the medical terms, what was happening, what kinds of things were available, the kinds of programs being offered, it was foreign to me. And so at that time, you're confused, you're anxious, you don't know what's happening, and you're not taking everything in. But the idea of the My Stroke Journey map was that it would lay out for the patient and the clinician a way forward that looked at from acute care to transitioning to another layer of care and then back into the community.
My hope for the outcome of all of this research is that the website and the brochure that was produced will actually be used by caregivers and those who are involved in looking after stroke victims.
I think that if that type of a resource was available, it would have made life much easier for my sister, who was my care partner during my stroke recovery. And it also, because it's there for you, you can go back to it at any time. You can revisit it at any time. Because we are in such a fog initially, you might not think of questions to even ask, but then later on, you can go back and go, oh yeah, now I can understand how I can implement the resources.
There's such a sense of abandonment and wondering what's next for me, that having this kind of tool available to people who have had a stroke, I think will make a tremendous difference in going forward in how they deal with their stroke.
I don't want to have to go through what I've been through. And if I can make it better for somebody, I'm glad to do it. I'm
several years out from my stroke now, and the journey is still continuing. And that resource is still a viable resource because it has not only things about the stroke itself and questions you might want to ask initially, but then it provides you with resources out in the community beyond what's available to you in the hospital setting.
Oh, I'm constantly referring to My Stroke Journey website because I've seen the result of it and seen how it can help people.
We felt it was important to have the kinds of services that are available in the community, and not just the medical services, but the support services, the discussion groups, the opportunities for getting together with other people that have survived stroke, to have the opportunity to gather knowledge and to explore possibilities and how you can become as active as you wish to be in your community once again.
This website will continue to be available through the Central South Regional Stroke Network.